Gentleman from Missouri is recognized for 15 minutes.
Thank you, Mr. Speaker. I'd yield myself such time as I may consume.
Gentleman is recognized.
Thank you, Mr. Speaker. Mr. Speaker, small businesses create 7 out of every 10 new jobs, and they are the driving force behind this great nation's economy. And we need these jobs as we attempt to rebound from a stubborn recession. As chairman of the Small Business Committee, I constantly hear from small business owners that the burden of government regulations and taxes is too high. The health care law is perhaps the worst offender. The last thing the federal government should do is discourage job creation. Yet this massive health care law, with all its costs and mandates and regulations and paperwork, does exactly that. Facing the expense and confusion this law creates, it's natural that small businesses decide to wait and see instead of invest and grow. And the worst impacts of this law are yet to come. We should be freeing up our small businesses to plan and grow and hire. Heavy-handed government causes both entrepreneurs to be cautious. Businesses are reduced from thinking about growth to thinking about survival. Brian Vaughn, a small businessman in Douglas, Georgia, planned to open a new store and reinvest profits. Testifying to our committee, he said, and I quote, "I fear that neither of these dreams nor my plans to achieve them will be possible. In fact, my worry is that everything I have worked for will be for naught and may be wiped out by this new health care law," unquote. Fortunately, we have a solution. Repeal this burdensome law. Stop it in its tracks before small businesses like Brian's are permanently harmed. Then pass common sense solutions. We want real reforms that put patients in charge of their health and bring down costs. This law is historic, but for all the wrong reasons. It reaches too far into the personal decisions of Americans, and it puts a heavy burden on our economy and small businesses. It's an example of big government at its absolute worst. We have a responsibility to repeal and replace this intrusive law before any more damage is done. So let's vote this big government intrusion out and give small businesses a real chance to do what they do best, and that's create jobs. With that, Mr. Speaker, I'd reserve the balance of my time.
Gentleman from Missouri reserves. The gentlelady from New York is recognized for 15 minutes.
Mr. Speaker, I ask unanimous consent to revise and extend my remarks.
Without objection.
Mr. Speaker, I yield myself as much time as I may consume.
The gentlelady is recognized.
I rise in strong opposition to the bill before us today. The Supreme Court's recent ruling upholding the health care bill was a historic win for this nation's small businesses and their employees. Repealing the Affordable Care Act will be an enormous step backwards for 26 million small firms who not only want relief from high health care costs, but for Congress to focus on job creation. This bill will not help a single small business secure a loan, break into new product markets, or invest in its operation. The other side acknowledges this legislation is going nowhere, just like the previous vote we took at the beginning of this Congress. Not only is the health care bill good law, it is good policy and has already led to major achievement for small companies since its enactment. The tax credits from the health care bill have saved over 300,000 small firms an average of $1,400 on their insurance costs. The Qualifying Therapeutic Discovery Project program has invested $1 billion in over 4,600 small, innovative firms that are developing groundbreaking therapies and creating jobs. Small firms are receiving more value for their premium dollars because the 80-20 rule is now in effect. Because of this, not only is the small group market receiving $321 million in rebate this summer, they're benefiting from lower premiums. The future of health reform will bring expanded coverage for preventive services and new state health exchanges in 2014, allowing more employers to purchase affordable insurance. Soon, prior medical conditions will not bar anyone from obtaining coverage. As the implementation of healthcare reform continues, improving the health of the nation's citizens will remain a priority for Congress going forward. At a time when economic growth is critical, we should be focusing on how to help small businesses raise capital and create jobs. Today's bill does none of this. Instead, it threatens our nation's job creators. It imposes a tax increase by eliminating critical small business tax credits, which have generated $485 million worth of savings. By doing away with reforms that establish new health insurance market, it will limit small businesses' ability to secure coverage and eliminate choices for entrepreneurs. Small businesses already pay 18% more for coverage than their corporate counterparts. The loss of new safeguards will compound this problem. Because of health reform, insurers are not longer able to raise rates arbitrarily. Passage of this bill will strip new protections that provide bargaining power to small companies. Rather than making improvements to the law, the Republicans want to eliminate it without offering any alternatives. While I agree that more can be done to make healthy living more attainable for Americans, voting for today's bill will not do that. One of the first votes I took this Congress was against Republican efforts to repeal the Affordable Care Act. I will continue opposing any efforts repealing a law that is beneficial to millions of small firms. I urge members to oppose the bill, and I urge the leadership to focus on meaningful ways to address this nation's economic challenges. And with that, I reserve the balance of my time.
Gentlewoman from New York reserves a balance of time. The gentleman from Missouri is recognized.
Thank you, Mr. Speaker. Mr. Speaker, at this time I would yield 2 minutes to my friend, the chairman of the Transportation and Infrastructure Committee, Mr. Micah of Florida.
Gentleman from Florida is recognized for 2 minutes.
Mr. Speaker, before I begin, I have a parliamentary inquiry.
Will the gentleman state his inquiry?
Mr. Speaker, I had not been privy to the prior debates of our discussion of subject and the repeal legislation at hand. Is it appropriate and within the decorum of the House to refer to the legislation that is being considered repeal as repealing Obamacare? I don't want to inflict any disrespect on the office of president, or should we refer to keep in the decorum and respect for the office from referring to the president's plan for health care government takeover as Obamacare, or in another term? What would be appropriate under the
The chair will not render an advisory opinion.
I'm sorry?
The chair will not render an advisory opinion.
But if I do refer to it as Obamacare, I'm not out of order?
The chair will not render an advisory opinion.
Okay. Well, thank you. And I have been instructed by the staff that the proper term of the title of the bill, I guess, Mr. Speaker, is repeal of Obamacare, but I wanted to clarify that before I began. As the Supreme Court rendered its decision, I had the opportunity to stand with some of my colleagues on the steps of the court just across from the Capitol. And I stood on the steps and spoke to the crowd gathered with other members of Congress, and I said, the decision by the court to again uphold the law that we seek to repeal, the decision was basically the decision to tax the people, and the power to tax, it's been said, is the power to destroy. I come before the House tonight and I'll state the same concerns I expressed on the steps of the Supreme Court. First, the power to destroy. It's appropriate tonight that the Small Business Committee is here and chaired by the distinguished gentleman from Missouri. American small business has been stuck in neutral, and the decision by the court and upholding this law is taking small business, which is stuck in neutral, and actually putting it in reverse. It's putting it in reverse because it is one of the largest tax impositions, call it a mandate, call it a penalty, that you can impose on small business, which is the primary economic generator in the United States. As a former businessman, I know the difficulty in trying to keep the door open, the lights on, the bills paid. And this is probably creating the greatest uncertainty and the greatest depression in the creation of jobs and expansion of small business in the United States. So indeed, the power to tax is the power to destroy. Secondly, I stand in support of the measure to repeal Obamacare, or the President's plan for health care, because of the impact on our senior citizens. The power to destroy something they sought as seniors, and a promise from our government, Medicare. To cut $500 billion from Medicare is not the way to go. That's why I oppose the President's plan and ask for its repeal, and yield back the balance of my time.
Gentleman yields back. Gentlelady from New York is recognized.
Mr. Speaker, since I have two speakers on this side, I will continue to reserve.
The gentlelady from New York reserves. Gentleman from Missouri is recognized.
Thank you, Mr. Chairman. Mr. Chairman, at this time, I would yield 2 minutes to the gentleman from Florida, Mr. West.
Thank you, Mr. Chairman.
Gentleman from Florida is recognized for 2 minutes.
Thank you, Mr. Speaker. A U.S. Chamber of Commerce survey showed that 74% of small businesses contend that the Patient Protection Affordable Care Act will make job creation at their companies even more difficult. A recent report by Bloomberg News noted that the President's health care law will impose an estimated $813 billion in new taxes on job creators and middle-class families, based on data from the nonpartisan Congressional Budget Office. Additionally, the law and the more than 13,000 pages of related regulation issued before July the 11th of 2012 are causing great uncertainty, slowing economic growth, and limiting hiring opportunities for the approximately 13 million Americans searching for work. Imposing higher costs on businesses will lead to lower wages, fewer workers, or both. Half of all small business income will face higher taxes, according to Bloomberg News and the analysis by the Joint Committee on Taxation, which also shows President Obama's plan for massive tax hikes would mean higher taxes on 53% of business income reported on individual returns. The Obamacare tax is already holding back job growth and medical innovation, with venture capital investment in medical device firms down over 50% in 2011 compared to any previous 5 years. Mr. Speaker, today I had 17 members of the South Florida chapter of the Association of Builders and Contractors saying that this law is going to adversely affect their businesses. Roger Dunshee of Twin V Catamarans in Fort Pierce, Florida, is considering who he will have to leave off of his insurance coverage or who he will have to completely get rid of from his business. David Carbone, president and CEO of St. Mary's Hospital in West Palm Beach, is concerned about how he will be able to run the hospital and also the type of care he will be able to provide. Dr. Mark Powers of the orthopedic specialist in Port St. Lucie, Florida, is concerned about what he will be able to provide as a small business owner. I ask for 15 seconds more, if I could.
I'd ask permission to yield the gentleman 15 seconds.
The gentleman's recognized for 15 seconds.
Mr. Speaker, this is not about taking anything away from the American people. We can keep what is good, but this is bad policy that had to be passed in order for us to find out what was in those 2,700 pages. Let us do what is right for the American people. Repeal this onerous monstrosity that is nothing more than a tax law and develop a health care solution for which the American people can be proud. I yield back.
Gentleman's time is expired. Gentlelady from New York is recognized.
At this point, Mr. Speaker, I yield to the gentleman from Michigan, Mr. Peters, 3 minutes. 3 minutes to Mr. Peters.
The gentleman from Michigan is recognized for 3 minutes. Correct. 3, is that correct? Yes.
Thank you, Mr. Speaker. I stand in opposition to the Republican Affordable Care Repeal Act because it is an irresponsible approach that does nothing to address the rising cost of health care that our families and our businesses are facing today. It is a fact that the fastest rising cost for most U.S. companies is health care. Without the Affordable Care Act, overall health care costs will continue to rise even faster, costs that will be borne by both the public and private sector. It is important to note that voting for this repeal bill will eliminate the small business health care tax credit. This tax credit currently allows small businesses to offset up to 35% of their health care insurance cost. Starting in 2014, the credit will increase to 50% of premium cost. Small businesses have faced outrageous increases in their health care costs over the past decade. The Affordable Care Act helps reduce that burden and is already making a real difference in people's lives. Nearly 2 million employees at 309,000 small businesses have taken advantage of the tax credit, receiving an average credit of $1,400. This repeal bill will put a stop to this important small business tax credit. And I want to make sure that we all understand that the repeal of the Affordable Care Act will result in a tax increase on small businesses, businesses which create almost two-thirds of all new jobs in this country. Let's be clear what the Affordable Care Act does for people and for small businesses. The Affordable Care Act prohibits health plans from imposing caps on lifetime and annual coverage. It bars cancellation of insurance policies. It guarantees free preventative care that lowers the cost of health care. It eliminates denial of coverage for pre-existing conditions. And by eliminating this unfair practice, health care reform helps nearly one-third of uninsured, self-employed entrepreneurs. But critics of the Affordable Care Act claim that they want to go back to the old system, a system where small businesses pay more on average for health insurance than large companies, yet receive fewer benefits. A system that has small business premiums rising 113% over the past decade. A system where our country continues to lag behind other advanced nations in delivering timely and effective care, and a system where Americans spend twice as much as other nations on earth but have worse health outcomes. The Affordable Care Act protects the nation's 26 million small businesses from unfair premium hikes and ensures that they have predictable and stable cost. Without the Affordable Care Act, out-of-control costs will only get worse, rising to $4.4 trillion by 2018. We cannot go back to business as usual. The Supreme Court has settled the issue of the law's constitutionality, and Congress should stop these election year stunts. This bill has no chance of being signed into law. We need to stop playing political games and focus on putting Americans back to work. Instead of just saying no, Republicans need to work with Democrats to improve and implement a law that ensures health care is affordable and accessible to all Americans.
It's expired. Gentleman from Missouri is recognized.
Thank you, Mr. Speaker. Mr. Speaker, I'd yield 1 minute to the gentleman from Illinois and the chairman of the Small Business Subcommittee on Economic Growth, Tax, and Capital Access, Mr. Walsh.
Gentleman is recognized for 1 minute.
I thank the chairman, and to my colleague on the other side, the small business health care tax credit has proven incredibly ineffective. The GAO itself has said that it is much too complex, and like everything Washington does, its temporary nature has really done nothing to reduce the cost of health care for small business. Mr. Speaker, my state of Illinois is hurting. Real unemployment has been above 11% for the past 3 years. I've heard from employers throughout my district that they do not support the President's health care law. They do not support the more than 13,000 pages of new regulations. They're already buried under regulations. They don't support the 21 new taxes. They're already overtaxed. And they definitely do not support the increased health care costs. They've seen their health care costs rise at an unsustainable rate. Mr. Speaker, the numbers speak for themselves. 74% of small businesses say the law makes it more difficult to hire additional employees. Why don't my colleagues on the other side listen to the people who create jobs in this country? Why do my colleagues on the other side always think They have all the answers. It's time we listened. It's time we repealed Obamacare. I yield back my time.
Gentleman from Missouri has 7 3/4 minutes. Gentlelady from New York has 8 minutes.
I yield myself as much time as I may consume, Mr. Speaker.
Gentlelady is recognized.
Mr. Speaker, on average, small businesses pay more for health insurance than large firms for compatible policies, but receive fewer benefits. Prior to enactment of the ACA, 20% of consumers were in plans that spent more than 30 cents of every premium dollar on administrative costs, and an additional 25% were in plans that spent between 25 and 30% of every premium dollar on administrative costs. The ACA included the medical loss ratio that requires insurance company to spend at least 80% of small employer premiums dollars on medical costs instead of administrative expenses. Is that bad for small businesses? When Republicans were in control of both chambers and held the Oval Office, they talked about this solution for nearly a decade, and yet nothing happened. In that time, small businesses saw the employees' premiums rise by an average of $700 every single year. Why should small businesses believe they can deliver on a promise this time? So finally, the law needs to be implemented. The most beneficial provision to small employers doesn't go into effect until 2014. The availability of state exchanges in 2014 could spur more small business owners to provide health benefits to employees. For example, in California, just 32% of small businesses currently offer health insurance to their employees, but the number of those likely to offer insurance through exchanges jumped to 44%. So don't repeal this legislation just for the sake of energizing the Republican base. You know that by enacting today's and taking this vote, this is going nowhere. What we should be doing, and someone on the other side said that we should be listening to small businesses. Yes, we are listening to small businesses, and what I hear from small businesses is that they are having trouble getting consumers through their doors, that they having trouble selling their products, that they're having trouble accessing capital. Those are the obstacles that they are facing today. This and that will prevent small businesses from creating jobs. And that is what this economy needs in order to get the economy growing again. So repealing this today is not going to create one single job. And with that, I reserve the balance of my time.
Gentlelady reserves. Gentleman from Missouri.
Thank you, Mr. Speaker. Mr. Speaker, at this time I'd yield 2 minutes to the gentleman from Illinois, Mr. Schilling.
Gentleman from Illinois has 2 minutes.
Thank you, Mr. Speaker. Like many in Illinois' 17th District, I'm disappointed that the Supreme Court decided to uphold the President's health care reform law. The Court ruled what we all knew from the beginning, but the President wouldn't acknowledge. The law's individual mandate is really a tax on the American people and businesses that create jobs. Under this law, the health care costs remain too high. Government bureaucrats remain between patients and their doctors. Too many Americans remain unemployed, with the national unemployment hovering above 8% for the last 41 straight months. The law's medical device tax will continue to raise health care costs and limit the ability of facilities like Cook Medical in Canton, Illinois, to expand and grow jobs. And the law's employer mandate will continue to force employers to choose between paying a penalty, increasing the number of employees eligible for health care coverage, replacing full-time staff with part-time employees, or laying folks off. Mr. Speaker, now is not the time to raise taxes on working-class families or employers. We need to repeal this law and get to work on a bipartisan health care reform that lowers costs and makes health care more convenient and more affordable. I'm new to Congress, but I have a plan to address rising health care costs while ensuring those who need it have access to coverage. I urge men and women from across America to visit shilling.house.gov to take a look. I yield back my time.
Gentlelady from New York.
Mr. Speaker, I continue to reserve.
Gentlelady continues to reserve. Gentleman from Missouri.
Thank you, Mr. Speaker. Mr. Speaker, at this time I'd yield 1 minute to the gentleman from Colorado and the Small Business Subcommittee Chairman on Agriculture, Energy, and Trade, Mr. Tipton.
Gentleman's recognized for 1 minute.
I thank the gentleman for yielding. The ranking member just listed off many of the challenges that businesses face, and we agree. But let me add one more. A company in Pueblo, Colorado, PDI, employing better than 200 handicapped individuals. That company is threatening to be able to see their business shut down because of Obamacare. They simply cannot afford it. That is the challenge that small businesses across this nation are truly facing. A $2 trillion tax. A $2 trillion tax when we need to be investing that in things like competition. Let's create those opportunities, positive opportunities, through health care, allowing the marketplaces to work, ensuring that people have those opportunities to have pre-existing conditions covered. Let's let our children who are 26 years old stay on those policies, but let's bring competition to the market and have things like tort reform as well. PDI and those handicapped individuals in Pueblo, Colorado are counting on common sense. Not politics as usual out of Washington, D.C., where one size fits all and Washington has all the answers. Let's not get between that patient-doctor relationship. The people are counting on positive action. I yield back.
Gentleman's time expired. Gentlelady from New York.
Mr. Speaker, I will continue to reserve.
Gentlelady continues to reserve. Gentleman from Missouri.
Thank you, Mr. Speaker. Mr. Speaker, at this time I would yield 1 minute to the gentleman from Colorado and Chairman of the Small Business Subcommittee on Investigations, Oversight, and Regulations, Mr. Kaufman.
Gentleman is recognized for 1 minute.
Mr. Speaker, the Supreme Court decision to uphold President Obama's health care reform law has reinforced the need for Congress to repeal and to replace this law. No doubt health care reform is important. Today, health insurance is far too expensive, and health care reform should lower costs and broaden access without compromising the quality of care. I support tax incentives to help individuals buy health insurance, high-risk insurance pools for those afflicted with pre-existing conditions, allowing small businesses to band together for the purchase of health insurance so that they can get the same discounts that large corporations receive, and medical malpractice reform to help bring healthcare costs under control by curbing the unnecessary and costly practice of defensive medicine. Mr. Speaker, it is time for Congress to act, to show the American people that we can accomplish meaningful health care reform without crippling the economy and bankrupting our nation. Thank you, and I yield back the balance of my time.
Gentleman yields back his time. Gentlelady from New York.
Mr. Speaker, I would like to inquire of the chair how much time each side has left.
Gentlelady has 5 minutes remaining.
I would like to
Gentleman
yield
from Missouri, 4 1/4.
to the gentleman from New York, Mr. Tonko, 3 minutes.
Gentleman from New York is recognized for 3 minutes.
Thank you, Mr. Speaker, and thank you to my fellow New Yorker. I rise today opposed to the 31st edition of this legislation and urge my colleagues to vote against it. Just what are we doing here today on the floor of this House? Are we passing job bills that will help the middle class? No. Are we working together to help America recover from the recession? No. Are we passing a bill that has any chance of being signed into law? No. So what exactly are we doing? Are we politically posturing during an election year? Yes. And are we voting to repeal a law that more Americans support than oppose without any hint of a plan for replacement? Yes. And are we voting to deny 6.6 million young adults health benefits under their parents' insurance? Yes. Are we voting to raise costs for some 5.3 million seniors who pay for their prescription drugs? Yes. Are we voting to deny 17 million children with pre-existing health conditions the opportunity for coverage? Yes. Are we voting to take away free screening and preventative checkups? Yes. So, Mr. Speaker, we can do better than this. Mr. Speaker, we must do better than this. The Supreme Court, the highest court in the land, a conservative-leaning court, has ruled, and the debate has ended over the constitutionality of the Affordable Care Act. Instead of repealing the health care bill for the 31st time in 19 straight months, in a Congress that has done absolutely nothing to create jobs, isn't it time to move on to something, anything, that will help our struggling middle class? Mr. Speaker, the American people are sick and tired of the games played on this floor. Let's end this debate and get back to work. Work that will find us passing bills that will help grow jobs. Work that will find us working together to inspire a thriving middle class. With that, Mr. Speaker, I yield back.
Gentleman yields back. Gentleman from Missouri.
Thank you, Mr. Speaker. Mr. Speaker, at this time I'd yield 2 minutes to the gentleman from Ohio, Mr. Shabbat.
Gentleman from Ohio is recognized for 2 minutes.
I thank the gentleman for yielding. And Mr. Speaker, the Supreme Court's unfortunate decision to uphold Obamacare doesn't mean it's the right thing for this country. It's not. It was bad public policy when it was forced upon the American people 2 years ago, and it's bad public policy today. Last Friday, the Department of Labor announced that millions are still out of work across this country. Businesses are still struggling to keep their doors open. It's unfortunate that this president doesn't seem to recognize that this law is hurting American workers and those looking for work. Businesses will be hit with more than $500 billion, $500 billion in new taxes, and the Supreme Court has said what it is, a tax, in a maze of burdensome red tape and mandates that could cost a loss of 1.6 million additional jobs. We can't afford that. And for what? A law that puts government ahead of people. A law that consolidates power into the hands of a group of 15 unelected bureaucrats. A law that has already increased health care costs and will limit Americans' access to quality, affordable health care. There is a better way forward. This misguided law must be replaced with patient-centered reforms that allow families to make their own health care choices and to visit the doctor that they want to visit. Health care decisions should be made at homes, around kitchen tables, all across the country, not in back rooms on Capitol Hill. Mr. Speaker, we do not need health care reform like this, but we do need health care reform. This law is not the answer. It's a big government power grab. That's what it really is. And what history has shown time and again is that big government makes things more expensive, more bureaucratic, and less effective. It's time to repeal this law and get our economy moving again and get Americans back to work. Yield back the balance of my time.
Gentleman yields his time back. Gentlelady from New York.
I continue to reserve.
Gentlelady continues to reserve. Gentleman from Missouri.
Thank you, Mr. Speaker. Mr. Speaker, at this time I'd yield 2 minutes to the gentlewoman from North Carolina and chairman of the Small Business Subcommittee on Healthcare and Technology, Ms. Elmers.
Gentlelady is recognized for 2 minutes.
Thank you, Mr. Chairman, and thank you, Mr. Speaker. I rise once again today to speak out against Obamacare and why we must repeal it. The Supreme Court's decision last month has verified that Obamacare is one of the biggest tax increases in modern history. Furthermore, a board of 15 unelected, unaccountable bureaucrats will now remain in place to determine the health care for millions of Americans while cutting $500 billion out of Medicare for our seniors. The American people now have a clear choice, and we in Congress can either support historic tax and spending, find fiscal uncertainty and unprecedented government overreach, or join together to fight to repeal this Obamacare tax and work for real solutions while taking health care decisions out of the hands of government bureaucrats and putting them back into the control of doctors, patients, and their families. By repealing Obamacare, we will restore the doctor-patient relationship and protect our seniors from ceding this relationship to a board of unelected bureaucrats. Our system must not dictate to doctors how to provide care, force them to provide medications regardless of known complications, and then make them liable with no limits or protections. Reforming the healthcare system and ensuring patient-centered access to care is not a Republican idea. It is not a Democrat idea. Rather, it is the obligation of all of us to the American people. Thank you, Mr. Speaker, and I yield back the remainder of my time.
Gentlelady yields back. Gentlelady from New York.
Mr. Speaker, I would like to inquire of the chair how much time is left on each side.
Gentlelady from New York has 3 minutes remaining. Gentleman from Missouri, 30 seconds.
Okay. At this time, I yield 2 minutes to the gentlelady from Texas, Ms. Sheila Jackson.
Gentlelady is now recognized for 2 minutes.
I thank you to the Speaker. I thank the gentlelady from New York for her distinguished commitment and service to small businesses across America. Mr. Speaker, I ask unanimous consent to place in the record a letter to the Governor of the State of Texas from Congresswoman Sheila Jackson Lee.
Without objection, so ordered.
Just a few minutes ago, a colleague rose to the floor and called this socialism. It is not. Many have risen to the floor to talk about how this will impact negatively on small business. It will not. I rise enthusiastically to oppose what is a political legislative act, the repeal of the Obamacare. It is really the Affordable Care Act. And by the statement of the United States Supreme Court, of which I read, the statement that Justice Roberts indicated, beginning in 2014, those who do not comply with the mandate must make a shared responsibility payment to the federal government. That is what this is about, sharing and bringing about health care costs that will come down, not up. And to my small businesses, let me say how much we care for you. I have supported small businesses throughout my public life and before, and I would argue vigorously that this helps to ensure that you can keep employees and add employees. In fact, between 2010 and 2011, healthcare costs dropped to 3.9% when it was above 6%, almost 1/2 less than before the Affordable Care Act was passed. This frankly exempts all businesses fewer than 50 employees. That means some 96% of American small businesses will not even be impacted. But for those who are, this legislation will provide $40 billion in tax credits for small businesses to offer health care. Now, in 2011, 360,000 small businesses have benefited from the health care tax credit, 2 million workers. And as well, you'll be able to ensure that rather than advertisement, your health claims or health insurance will cover 85% of your premium will be on health claims and improvement activities, not advertisement. It entails that if an insurance company pays $70 for every insurance claim and quality improvement activity, you will get rebates, $127 million in total rebates in the individual market and $1.3 billion, Mr. Speaker, to consumers and businesses. The fact is, this is the right thing to do. Support Obamacare, oppose the repeal. This is good for business. I yield back.
Who yields? Time.
Mr. Speaker, I'm prepared to close.
I'm prepared to close if the gentleman doesn't have any further speakers.
In that case, gentlelady from New York is recognized for 1 minute.
Thank you. What will small businesses lose if health care reform is repealed? Small business tax credits that save employers $435 million in 2011 will be abolished. Insurers will be able to continue price gouging their customers and denying coverage for pre-existing conditions. Repeal will mean millions of families and employers will not longer receive the benefit of lower premiums and insurance company rebates worth of over $300 million this year alone. I urge a no vote because the ACA was a step in the right direction. Without it, the self-employed and small business employees will continue to be uninsured at high rates, with no hope of Republican action to fix the broken healthcare system. Mr. Speaker, instead of holding this vote, we should be spending our time on targeted measures to help our nation's small businesses grow and create jobs. Maybe what we should be doing today is debating the jobs bill that the President
Time's expired.
presented to us in the House of Representatives. I yield back the balance of my time, and I urge a no vote.
Gentlelady's time has expired. The gentleman from Missouri is recognized for 30 seconds.
Thank you, Mr. Speaker. Mr. Speaker, I'd like to address the comments made by the speaker before, the last speaker, the gentlelady from Texas, who claimed that 4 million small businesses are going to be able to take advantage of this tax credit and how much it was going to help. We requested a GAO study and found that only 170 small businesses have even taken partial advantage of this credit. This bill is grossly ineffective. It does not work, and it hurts small businesses. Now, I would urge my colleagues to vote to repeal this piece of legislation and help get this economy finally rolling so we can pass some real reforms when it comes to health care. With that, I yield back the balance of my time, and I appreciate it.
Okay. The gentleman yields his time back. Pursuant to Clause